Tom is a patient on the med-surg floor being treated for severe burns. The nurse is ordered to mechanically debride the wound with a washcloth during Tom's morning bath. Since the nurse is taking care of 3 other patients, she saves time by quickly grabbing a used bath basin by the sink counter. 2 days later, Tom notices extra redness and pus draining from his burn site. After gathering a wound culture, the results show that a staph infection is present.
The major problem of this story is that the nurse did not use the best practices with the bath basin. The basin had been previously used to bathe the patient, thus spreading the infection to Tom. She was supposed to dispose of the old basin and grab a new, clean one from the supply closet. One of the primary system causes of a nosocomial infection is reusing contaminated bath basins. Basins are used to clean patients and can be left in an environment that fosters bacterial growth. When the basin is simply reused and not disposed of properly, it can easily transmit the bacteria.
A study in the American Journal of Infection Control found that 62.2% of over 1,000 basins sampled contained at least one pathogen. These pathogens ranged from vancomycin-resistant enterococci, Staph aureus, and MRSA. Another study found in the American Journal of Critical Care sampled 92 bath basins and found that 98% of these basins contained some form of bacteria. In addition to finding MRSA, Staph aureus, and vancomycin-resistant enterococci, they also found traces of Pseudomonas, Candida albicans, and E. coli bacteria.
The most current evidence-based practice shows that getting a new disposable bath basin before every bath is the best way to prevent the transmission of bacteria in this situation. In a study published by the American Journal of Critical Care, patients' skin flora was sampled for bacteria before they were given a bath. Patients that received a bath with a basin that had been used before and simply cleaned out had the same amount or more bacteria than with a patient that was bathed in a disposable basin. When nurses' satisfaction was measured, nurses reported consistently positive responses about using disposable basins because it saved time with cleaning and obtaining bathing supplies.
Some may argue that using disposable bath basins is more expensive. When considering all factors, such as the cost of the bath basin, cleaning supplies, and the average cost of the nurse's time, the cost disposable bath basins technique is comparable and actually less than reusing a bath basin. The overall cost of the reused bath basin technique comes out to a total of $19.87, compared to $18.15 for the disposable bath.
Because it will not have to pay for treatment of nosocomial infections that result from contaminated bed baths. Multiple research studies have shown that in long-term care units, disposable baths were associated with shorter stays and reduced skin dryness and skin tears. This was compared to facilities that reuse bath basins where the cost of treating nosocomial infections is elevated and more skin tears are reported.
With evidence presented, it is time to take action. Talk to your nurse manager about implementing this policy on your floor. Collaborate with the infectious diseases unit for the hospital about properly disposing bath basins. Research has shown that having a designated container for used basins in each room that is removed each day reduces the chances of basins being reused and can reduce the spread of communicable diseases. By working as a team for the good of our patients, we can prevent nosocomial infections from bath basins.